It's been described as a war zone in West Africa. International relief organizations say the Ebola virus is spreading at an alarming rate and could take another 6 months to contain.
We don't even know how the sickness got into this country, and it's really killing our children, our families, and everybody. We are all suffering from it.
Just mentioning the word Ebola can create panic and fear among the people of Nigeria. Many simply don't understand how the virus is spread.
I heard that what brought it is a bat and rabbit, monkey. So we have to be careful because it's a sickness that kills quick.
Researchers suspect the first patient behind the current outbreak was a 2-year-old boy who fell ill and died last December in the village of Gurkedo in southeastern Guinea. From there, the deadly virus spread to neighboring Sierra Leone, Liberia, and eventually Nigeria. According to the Centers for Disease Control and Prevention, Ebola is spread through direct contact with the blood or bodily fluids of an infected person or animal, or with contaminated objects such as needles. Symptoms include high fever, diarrhea, bleeding, and vomiting. There is no cure, and during this current outbreak, about 60% of those infected are dying.
I urge the international community to respond urgently to the shortage of doctors, nurses, and equipment, including protective clothing and isolation tents. We need all hands on deck.
On August 8th, the World Health Organization declared the Ebola epidemic a public health emergency of international concern. The group stated the Ebola outbreak appeared to be vastly underestimated and called for extraordinary measures.
We've seen with the opening of new treatment centers, many more Ebola patients come forward. And so this has given rise to the belief that there are probably a lot of patients out there that we haven't traced or contacted yet.
The UN Health Agency is also urging Ebola-affected countries to start screening all passengers leaving international airports, seaports, and major ground crossings. The World Health Organization says while the risk of transmitting the Ebola virus is low, every precaution must be taken. Meantime, medical workers are putting themselves at risk in hope of saving lives.
15 of our health workers from this case management center have passed away. When somebody dies of Ebola, that time the virus is very virulent. And in that case, we have to handle that corpse very well in order not for us to be infected.